Good morning. I'm Eileen Doherty, Executive Director of the Colorado Gerontological Society. As the director of the society, a nonprofit organization, older adults often tell us they didn't know about many programs, services, and benefits for which they are eligible. One of our main goals with Senior Answers, in partnership with Legends Radio, is to share information and help you, our listeners, take advantage of these programs. Today, we're going to talk about prescription drugs and the Medicare open enrollment period. Open enrollment started October 15th and will continue through December the 7th. Anyone who is a Medicare beneficiary needs to be enrolled in a standalone prescription drug plan or a prescription drug plan as part of a Medicare Advantage prescription drug plan. Today, we're going to focus only on the standalone prescription drug program. So if you are in a Medicare Advantage plan, this information is only for you. There are 5 companies this year selling standalone plans. They are SilverScript, Humana, AARP United Healthcare, WellCare, and HealthSpring, which is formerly Cigna. Several companies have left the marketplace. It's important to note that AARP, Humana, and WellCare are not paying commissions this year to Medicare insurance brokers. Thus, these brokers will not be able to assist you in enrolling these plans. This policy of brokers not being able to help you, however, does not affect your own enrollment online if you do it yourself. This year, one of the things that has increased is the basic benefit. So we have a $615 deductible and a maximum out-of-pocket of $2,100. This is your money. Last year, or this year in 2025, the maximum out-of-pocket was $2,000. Once you spend $2,100 of your money next year, you will reach what's called the catastrophic coverage. And at that point, you will not have to pay any more for your prescriptions. It's also important, as you're thinking about prescription drugs, to think about the different tiers. So there are 5 different tiers. Tier 1 is called preferred generics. You usually pay somewhere between $0 and $1 or $2 per prescription. Generic or Tier 2, you often pay between $1 and $15 per script. On Tier 3, you have preferred brand, which is 25% of the cost of the drug. Tier 4 is what's called non-preferred brand, and that is the highest out-of-pocket percentage of 31%. And specialty drugs, which are the very high-end cancer drugs, antivirals, stuff like that, and those are 25% of the cost of the drug. Now, as you're thinking about which company you want to go with, not all drugs are on the same tier in each company. Additionally, you should know that the prescription drug plans have some different requirements called protected classes. But before we talk about protected classes, you should also know that not all pharmacies charge the same copay or have things, they have them on the same tier, but the copays could be very different from, say, a King Soopers to a Safeway to a very small neighborhood pharmacy. So let's talk a little bit about some other requirements that the prescription drug plans have. 1 is called protected classes, 2 is insulin, and 3 is vaccines. And we'll talk about each one of those individually. There are 6 classes of drugs called protected classes. This means that the prescription drug company has to cover all drugs in that class. These classes include immunosuppressants, antidepressants, antipsychotics, anticonvulsants, antivirals, and antineoplastics. These are all very highly sensitive drugs, and people who take these drugs often have very severe health conditions that need to be monitored, and oftentimes people do not respond well to some drugs, but will respond much better to others. So we don't really want to have people switching on those kinds of drugs. The second thing that we're going to talk about a little bit is insulin. For those people who are diabetics, this is absolutely critical and important. All prescription drug plans have to cover insulin. The maximum cost that is allowed under federal law is $35 per vial per month. So if you have a long-acting insulin and a short-acting insulin, you would have to pay $70 or $35 for each vial. However, if you need more than one vial each month, you would not have to, of the long-acting or the short-acting, you would not have to pay the second $35, or if you even needed more than that, you would not have to pay the additional $35. So you only have to pay that once, and everything after that is free. Now let's talk a little bit about vaccines. So prescription drug plans, again, are mandated to cover certain vaccines or immunizations. So they have to cover shingles, Tdap, COVID-19, and RSV. Now you need to get these prescriptions at your pharmacy so that your pharmacy can bill your prescription drug plan. You can get your flu vaccine, pneumonia, and hepatitis B at that same pharmacy or a different one, or you can get those three at your doctor's office. So the shingles, Tdap, COVID-19, and RSV are Part D vaccines. The flu, pneumonia, and hepatitis are Part B of Medicare vaccines, and whoever you get them from has to be able to bill Medicare Part B. That's why getting the first group of immunizations from your doctor's office usually doesn't work, because they don't have the ability to bill your Medicare Part B. Now, there's been some question as to whether or not you could get a COVID-19 shot and whether or not that would be covered. The actions taken by the CDC group a couple weeks ago did not in any way affect the payment for COVID-19 for Medicare beneficiaries. So you can go ahead and get that as you normally would have. Another thing to know about prescription drugs is a thing called medication management. This is often called utilization review. So one thing is prior authorization. What this means is that you have to get your doctor and or the pharmacy have to get prior approval each time you prescribe a drug, if it is required to have prior approval. The second thing is called step therapy, and here's where they would require you to take a cheaper or less costly or different drug before you would get the one preferred by your doctor. And the third thing is quantity limits, and what happens there is that the company will only pay for a certain number of pills each month. So if you take a standard dose, such as 1 or 2 pills, don't worry about it if you have a drug that's on quantity limits. If you take more pills per day, then you may need to be concerned. Another thing that the government did a year ago is they created this thing called a prorated payment plan. And what that means is that if you do not have the money to pay the deductible and or the balance of the $2,100, you could put up front before your insurance covers, you could put that on a payment plan. And what you do is you tell the pharmacy that that's what you want to do. Then you call the prescription drug plan, enroll in their payment plan. The prescription drug plan then will send you a bill each month and you pay it. If you get a second high or expensive drug somewhere during the year, that just gets added on to your existing monthly payment. The only thing to know is that you have to pay the entire out-of-pocket amount up to the $2,100 if that's how much you have used by December 31 of 2026. If you're currently enrolled in this program of a payment plan, it will automatically roll over to 2027. There's also a thing called the gag clause. And what that means is that you can ask, and your pharmacist can tell you if there is a cheaper way or a cheaper copayment for the drug that you might be trying to get. So let's say you have a tier 3 drug. They want $100 for it because that's the 25%. You can ask the pharmacist if they can use GoodRx or one of the other discount programs. And if the cost of the drug is, say, $20, you can use that. What happens, though, is that that drug then does not, or the cost of that drug does not count toward your deductible. But you've saved $80, so it's probably worth it. If you I've now taken all of this into consideration, and now it's time to basically enroll in your prescription drug plan or to continue the one that you have this year. We don't advise that you continue without checking because there's been a lot of change on the tiers. There's been a lot of change on the copays, the prior authorization. So we really recommend that you go to Medicare.gov, go to the plan finder, put your drugs in, and see what's going on with your particular situation. If you cannot afford and need help paying for your prescriptions, you can call the Social Security Administration at 1-800-772-1213 for help, or you can go to their website at ssa.gov and enroll in what's called the Extra Help Program. This then will help you pay for the deductible as well as the copays. In addition to the support that is being provided by the pharmaceutical companies, the Colorado Gerontological Society is offering some support as well. We are offering in-person Medicare Monday programming all around the metro area as well as throughout the state. We are doing Wednesday lunch and learns online. And so you can check our website for that and the different topics throughout open enrollment. The third thing we're doing is sessions on new to Medicare for those people who need help. If you need additional support, please call 303-333-3482. That is our general telephone number, and we can help you. A big thank you to Sam's Club and Legends Radio for making this program possible.